Period cramps are throbbing or cramping pains in the lower abdomen, often starting just before or during menstruation, and sometimes radiate to the lower back and thighs. There are two types of menstrual cramps. Normal period cramps, or primary dysmenorrhea, are caused by natural hormone activity. This is the most common type in females. More severe period cramps, or secondary dysmenorrhea, are caused by an underlying reproductive condition, such as endometriosis, fibroids, or adenomyosis. Besides stronger pain, secondary dysmenorrhea often includes other signs like heavy bleeding, pain during sex, pain during bowel movements or urination, irregular periods, and symptoms that get worse over time. This type usually requires medical evaluation and treatment. During the menstrual cycle, if no pregnancy occurs, hormone levels, especially progesterone levels, drop. This triggers the uterine lining, endometrium, to release hormone-like substances called prostaglandins. Prostaglandins are multifunctional substances produced in many tissues of the body. They play key roles in regulating inflammation, controlling blood flow, aiding blood clotting, and triggering the contraction or relaxation of smooth muscles, such as those in the uterus and digestive system. During menstruation, prostaglandins are released by the uterine lining to stimulate contractions. These prostaglandins signal the uterus to contract, similar to mild labor pains, to expel the endometrial lining. These strong contractions can cut off blood flow temporarily to the uterus. The reduction in blood flow helps facilitate the shedding of the uterine lining by limiting excessive bleeding and aiding in the detachment process. Reduced blood flow leads to a lack of oxygen and nutrients in the uterine muscle tissue. This triggers pain. When prostaglandin levels are high, the contractions can become overly intense, leading to prolonged ischemia and more severe cramps. This mechanism is a normal part of menstruation, but it can become problematic when prostaglandin production is excessive. Prostaglandins can also impact other organs like the bowels and rectum, causing diarrhea, stomach, resulting in nausea or vomiting, and the nervous system can result in fatigue, headache, and irritability. Prostaglandin levels peak in the first 1 to 2 days of menstruation. That's when cramps are typically the most intense during the first days. As levels decrease over the next few days, cramps usually ease. Period cramps can feel more painful some months than others, which is why period pain can be so unpredictable. This is because the balance of hormones like estrogen and progesterone can vary each month. This can affect the amount of prostaglandins the body produces. High levels of stress can also have a significant impact on the menstrual cycle in multiple ways. Diet and habits in the days leading up to the period can also play a role. Diets high in processed foods, sugar, and saturated fats can increase inflammation in the body, which may lead to higher prostaglandin levels and more pain. Not drinking enough water can lead to dehydration and muscle cramps, which can make period pain worse. Poor sleep can also contribute to heightened pain sensitivity and a higher inflammatory response in the body, making cramps feel more intense. A sudden change in exercise routine, either becoming more sedentary or over-exercising, could affect the pain levels. There is strong evidence that smoking worsens primary menstrual pain. A recent prospective study also found that dysmenorrhea is linked to increased exposure to environmental tobacco smoke. Additionally, frequent life changes, limited social support, and stressful close relationships may contribute to more severe menstrual cramps. Age is an important factor in menstrual pain, with symptoms generally being more pronounced in adolescents than in older women. There is also some evidence that women who have given birth, Paris women, tend to experience less severe dysmenorrhea. To manage menstrual cramps, the goal is to often reduce prostaglandin production. Over-the-counter, OTC, pain relievers such as ibuprofen and naproxen can help to block prostaglandin production. For the best relief from menstrual cramps, start taking them just before your period begins or at the first sign of cramps. On the other hand, drugs like ibuprofen may irritate the stomach. This risk increases if the medication is taken on an empty stomach, used for several days in a row, or if you have a history of ulcers, acid reflux, or gastritis. To reduce side effects, it's best to take these painkillers with food, use the lowest effective dose for the shortest possible time, and avoid alcohol while taking them. Pain relievers such as acetaminophen help to relieve pain, but do not target the prostaglandins in the same way as NSAIDs. It works by blocking pain signals in the brain. It is generally less effective for menstrual cramps than NSAIDs, but it can be a good option for people who cannot take NSAIDs due to medical conditions or side effects. Applying a heating pad or a hot water bottle to the lower abdomen can help relax the uterine muscles, improve blood flow, and ease pain. Regular, gentle physical activity such as walking, stretching, or yoga can release endorphins, which are natural painkillers. If your cramps are getting more severe over time, accompanied by heavy bleeding, disrupting your daily life, and not improving with regular treatment, consult a healthcare provider. Conditions like endometriosis, adenomyosis, or fibroids could be the cause.